Hello, everyone, and welcome to the June webinar for the National Alliance for Patient and Worker Safety. My name is Fran Griffin, and I'm a patient safety and quality consultant working with the Alliance team and will be moderating today's session. Please note that everybody is in listen-only mode at this time, and we will be using the chat throughout the session in order to engage all of you with today's speakers. So a few housekeeping instructions as we get started. The webinar is being recorded and will be available for viewing on the Alliance website at a future date. We will be using chat, as I mentioned, throughout the webinar, and closed captioning is available if you need to turn it on, and you can see there is a brief picture here to show you how to turn that on if you like. So to start today's webinar, we want to frame it with our questions to run on for today's session, which gives the framing for how we will be thinking about our topic today, which is empowering the patient voice. So our framing is, what strategies for engaging and partnering with patients and families can most effectively impact an organization's safety culture? What can healthcare organizations at different stages in their journey to partner with patients and families do to advance their efforts in the short term? So similar to our previous webinars, our goal is to really help you think about actions you can take following today's webinar. So we'd like to start by posing a question to all of you and have you use the chat to share your responses. So we'd like to know, before we get started, what aspect of engaging patients and families would you most like to learn more about today, or how to do better? We have 3 speakers that I'll be introducing in just a moment, who will share their experiences with engaging patients and families and tips for success. We'd like to know first, what are you most interested or hoping to learn more about today? Please post your comments in the chat and send it to everyone so that we can all see them. And we'll just pause for a moment to give you a chance to type those in, and then we'll move to our speaker introductions for today. Great, thank you. So I see that we've got our first one already entered. So thank you, Karen Fernandez, for entering that on how to educate patients and families to report safety concerns. That's a great starter. Hope to see some more in there. While folks are chatting in, why don't we go ahead and introduce our 3 speakers for today? And my pleasure to welcome the 3 of them to today's webinar. So all 3 of our speakers today come from Cincinnati Children's Hospital Medical Center, which has done extensive work over the years on engaging patients and families. I had the privilege years ago to visit Cincinnati Children's when I was working on some other projects, and so actually know at least one of the speakers on today's webinar. So I'll introduce them as they get into their individual presentation. So I'll start with Dr. Stephen Muthing, who's the Chief Quality Officer and co-director of the James M. Anderson Center for Health Systems Excellence at the Medical Center and a professor of pediatrics at the University of Cincinnati College of Medicine. He focuses on strategic goals of Cincinnati Children's to improve all aspects of care, including safety, outcomes, and others. His research and national impact focuses on high reliability, large-scale healthcare safety, lean culture transformation, and development of learning networks nationally. He has led the IHI National Steering Committee for Healthcare Safety, National Patient Safety Agency Advisory Panel, International Society for Quality Healthcare, and National Action Plan for Patient Safety. And Dr. Muthing was one of the founders of the Children's Hospital Solution for Patient Safety and now serves as the strategic advisor. I'll introduce his colleagues when we are ready to get into their presentations. And I'll start by turning it over to you, Steve.
Well, thank you very much, Fran, and thank you to all of you for taking time this afternoon or this morning, depending on where you are, to join us, and for all you're doing for the National Action Alliance and leading safety at your organizations. It's just a real honor to be with all of you. And my colleagues and I are excited to share. What we plan on doing today is focusing in on some real life aspects of how we are engaging and partnering with patients, families, and frontline staff. Uh, Immediately, when we talk about patient safety, we immediately want to, most of us want to learn about how to better and most effectively engage with patients and families. The reason uh, we've expanded on that is at Cincinnati Children's, when we talk about safety, we talk about everybody's safety at equal emphasis. So here, if you were here, you'd find that when we talk about this topic, yes, we focus in on partnering with the patients and families, and that's why Pam Wendell, you'll hear from her shortly. But we focus significantly on workforce safety, employee safety, and that's why Deanna Hawkins will be focusing in on some of our journey about how to best engage with all of them. Now, my job is to be the setup man, I have to say. I'll be doing some introductions, which I'm doing right now. I'm going to discuss the journey at Cincinnati Children's and at Solutions for Patient Safety, give some context basically on where this all fits in with engaging with the patients and families and frontline staff. But really, it's Deanna and Pam who will really be sharing, I think, the take-home messages, because they're going to be sharing the practical aspects of how and how we've done this, what we've learned, and what we still need to do better. So, without further ado, let's jump right in. Next slide, please. Fran mentioned some things we might want to hear. Two additional things that Deanna and Pam and I wanted to share is that, listen, we are huge believers in all teach, all learn. Every time we give a talk like this, honestly, we're more excited to hear from you because when you get over 100 of us together, which we have today, there's always somebody doing a cool idea that we can borrow or steal or share shameless or freely with each other. So listen, feel free to chat in things that you're doing well. This might be a chance to brag. Do it. And then also the other thing we wanted to share with us, with all of you, is that any question is fair game. We want you to push us. If you hear something you don't agree with, or we didn't make sense, or any of those kind of things, let's be psychologically safe. Push back. That's how we can all learn together. Let's not just cruise along the top here and just let's go deep together. And we have to be psychologically safe to do that. So next slide. A little bit more about me. Fran, you were very kind in sharing some of my CV or resume, I guess. Listen, more important than all that, I'm a human. I am a husband. I'm married to my best friend for 42 years. I am a dad, and the best job in the world. I have 8 fun grandkids. Career-wise, my path is I'm a pediatrician. I started my career as a small-town pediatrician. Actually, I was a solo doc at the very beginning. I did that for 13 years, and it was fantastic. Eventually, I became, through various changes and developing leadership roles, I became the safety officer, chief safety officer at Cincinnati Children's. Did that for 10 years. As Fran mentioned, I was the original clinical director for Solutions for Patient Safety. I'll tell you some more about that. Did that for about, I think, 7 or 8 years. I've been the chief quality officer for the last 8 years. I'm kind of getting toward the end of that. And now, actually, I'm spending almost all my time, and will be spending shortly all my time, helping other hospitals and health systems. Both our official partners of Cincinnati Children's, partner hospitals, but also just honestly hospitals all over the U.S., all over the world, helping them on their quality and safety journey. It's a fun opportunity to have. Next slide. And I told you I'd give you some context, just a little bit about Cincinnati Children's. We're a small to medium health system. We have 19,000 employees. We're an unusual health system because we're just pediatrics, nothing else. For a children's hospital, we're very large, one of the largest in the world. But for a health system, small to medium, we actually see kids at over 75 sites. We see kids from all 50 states, from more than 50 countries. And you probably are aware, that we were rated #1 in by U.S. News this past year. But if you know Cincinnati Children's, we took that opportunity to basically change everything and say, well, that's fine, but we're not satisfied. And so we've been going through the last year some really significant restructuring with our operations system, a new culture change and things, focusing on honestly how to improve our quality even more in terms of access, safety, others. So if you really want to know about Cincinnati Children's, it's the vision down at the bottom, which really tells you everything. Our vision is to be the leader in improving child health. And that middle word there, improving, it's a verb. We're never satisfied. We're constantly challenging ourselves to move forward. And as just evidenced by this year is rather than sitting back and say, oh, that's good. We've got some nice rankings. We said, no, we're not satisfied. We're not doing good enough for the families and patients and frontline staff. Next slide, please. So, you know, at any organization, you could talk about the journey. I put this together just to say, here's a very, very simplified view of our journey. The key points, none of these specifics am I going to go into on just short time today. But the key point I want to make is that if you look at our safety journey, I would describe that we really started going all into it around 2004, 2005. And so we've been relentlessly working on improving safety at Cincinnati Children's for almost 20 years. And I don't think any of you will be surprised to hear we're not there, nor will we ever be there. But we relentlessly focus right up through today. And just for instance, in the next fiscal year, which here starts in about 2 weeks, we're going deep on psychological safety once again across our organization. We've done it. We've made a lot of improvement, but we're still not satisfied because we think the ability to have families, patients, frontline staff speak up and know that it's their job, and for most importantly, to know as a leader or a colleague, I have one job when somebody speaks up, and it's to listen with grace and gratitude. Next slide. So I just want to sum up that journey and really give you these 4 key factors I have to say. When people ask me, what have you really learned? What's driven this at Cincinnati Children's? As I just mentioned, it's the relentless pursuit of the vision of zero harm. We have never reached zero. We will never reach zero, but we never stop. This is just as critically focused on today as it was 20 years ago when we started. The CEO still leads the safety oversight group here at Cincinnati Children's. Every board meeting starts with safety, both employee and patient safety, every single one. Every huddle, every day at all tiers, tier 1, tier 2, tier 3, focuses on safety. Number 2, it's transparency and a culture of learning. Transparency, I'm going to show you just a couple data charts here in a second. But more importantly, it's that culture of learning. Every single day, we're talking about what do we learn today? In fact, I heard Deanna Hawkins, who you're going to hear from in a second, this morning on our Tier 3 huddle, talking about some codes that happened yesterday at Cincinnati Children's and what we've learned already. Deanna walks the talk. Number 3, learning with others. You know, when we started our journey, it was us. We just learned by ourselves. We never shared with others. We never asked others to share with us. Through SPS and other means, we came to realize that was dumb. There's no benefit to learn, or very limited benefit to learning from ourselves. It's not until we really start sharing with others. And so I'll share about SPS in a minute, but we've come to realize we never should have been learning by ourselves, and boy, do we learn faster when we learn with others. And finally, and what the topic of today is, partnering with families, patients, and frontline staff. But I'll leave that to Deanna and Pam to really go deep on. Next slide. So just a couple charts. This is our serious safety event rate. I don't know how many of you use the work around serious safety events to track your worst of the worst events. Basically, this chart goes over 19 years. As you can see, when we first started, we were having a serious safety event here at Cincinnati Children's every 21 days, more than once a month. These days, we still haven't gotten to zero. We average 0 to 3 serious safety events per year now, so closer to every 100. In fact, I just checked, and today is 274 days here at Cincinnati Children's since our last serious safety event. Still too many. Next slide, please. This is for employee safety. This is all our organizations track this. This is days away or restricted or transferred or DART. These are the worst workforce injuries. And you can see, I'm not just sharing out good data, we're getting worse. And this is from patient interaction injuries, particularly in our 100 beds focused on taking care of the most severely affected mental health kids. And we're really focused on this right now. And that gets back to that relentless focus on safety. Next slide. So wrapping it up for my part, so we can turn it over to Deanna and Pam. Why about engaging patients and families and staff? The reality is, yeah, I can show you charts all day, but it's not the numbers, it's not the rates. And the families come to us, all of us, in their most stressful times, with their most dire situations, and in our case, with their most precious thing they have is their kids, and they're asking us for help. But what they really expect, whether they say it out loud or not, is that we keep them safe. And yeah, we can do our standard approaches, and we do, and high reliability approaches, and we do, but you can't really understand how to keep people safe unless you talk to them. It's their perspective on what's this like to be a family in a hospital that's really the most important. So, next slide. And it's really the same for our staff. Look, as an executive, I was a frontline pediatrician. I was a small town doc. I knew what it was like then. I'm the one who spoke the experience. Now, as an executive, it's not good enough for me to just say, oh, yeah, I remember when I was a pediatrician, or a nurse leader say, oh, yeah, I was a frontline nurse. We have to work with the frontline staff. Let's be humble and understand we don't really know what it's like. It's the frontline staff who can help us with that. So that's it on Cincinnati Children's. A few minutes on SPS. Next slide. Solutions for Patient Safety, SPS, is started with 6 and then 8 of the children's hospitals in my state, Ohio. Started about 12 to 15 years ago. And we started with a simple statement of what would happen if we shared all of our data with each other. There were some of us who feared the world would come to an end. But eventually we agreed, let's stop competing on safety and start cooperating on safety. Next slide. Over years, that has grown, and now it's over 140 children's hospitals across the US and Canada. And every single month, we share all of our safety data with each other, all of our safety data, all of our learnings, all of our harms, all of our progress, all of our best practices. We've come to realize across the entire United States and Canada amongst pediatrics is it's not okay to keep things to ourselves. We cannot do that, and we do not compete on safety. Next slide. SPS. I could share numbers and charts on SPS all day with you too. I just want to draw your attention to that one number right there. 25,120. When you add up all the reductions in harm across the United States and Canada, there have been over 25,000 families who have not experienced serious harm while being cared for at the children's hospitals in the United States and Canada. Next slide. So just briefly, some learnings from SPS. We've learned that the best way to learn how to partner with patients, family, and frontline staff is to learn from each other. Somebody's always doing something better than us. Let's share. And somebody's always needing our help. So let's share what we do. We've found about the critical role of parents on the governance of SPS. We have family members who sit on the board of Solutions for Patient Safety, along with the CEOs of the children's hospitals and other executives. And then finally, families and patients are amazing teachers. They're featured at our learning events. They are featured as keynote speakers. They are teachers in breakout sessions. They co-teach with staff and executives and leaders at children's hospitals. We wouldn't have it any other way anymore. So That's the end of the setup. Now let's get to the real meat of the issue is, and remember, we're looking for your input. We're looking for your questions. Next slide, please. So Pam Wendell is a good friend. Let me say first of all, she's also our director of family relations at Cincinnati Children's. But the real reason she's here is she's an amazing mom who's been taking care of her kids, and one of whom, who I know very well, is because she has spent way too much time of her life, especially when she was younger, at Cincinnati Children's, needing a lot of help. She has a complex medical situation, and I really met Pam in a role of trying to teach us as a mom, and she's about to do that shortly. And then after that, next slide, you're going to hear from Deanna Hawkins, who I first met as a frontline nurse, who is just one of those people who, when you meet her, she's got the it factor. This woman is amazing at advocating for her patients, but the way we're really going to hear from her today is how she has, over the years, become an amazing leader, first at the unit level and then at the area level. And now she's a vice president of nursing here at Cincinnati Children's. And she has relentlessly been one of the people, and along with her frontline now, working with them on advocating for the front line. So we're going to start with Pam. And with that, I will turn it over to you, my colleague, Pam Wendell.
Thank you, sir. Well, good afternoon, everybody. Thanks so much for inviting us. It really is an honor to be here sharing a little bit about what we've learned individually and as a system about involving patients and families in safety work. So I think, first of all, the first step is that you're reaching out and you're trying to learn more. And that is one of the keys, I think, to making anything work, but especially being open to learning what you don't know is important when you're working with patients and families. So as Steve said, you could describe me lots of different ways, but really the story behind it is I had a daughter born in 2001 with spina bifida, and she has taught me and so many others so much. She's 23 now. She turned 23 last week, and so we're navigating the scary transition to adult care, and we'll miss our pediatric partners, but. So she teaches us a lot. And while I started my career as a high school English teacher, when I was able to go back to work when she was about 10, I knew that I wanted to go and continue my work in advocating for families and for patients. So I got lucky enough that there was a patient advocate job available at Cincinnati Children, and have been there for 14 years, and now get to be director of family relations. So I'll talk a little bit about my perspective as an employee, but most of it is most deeply rooted in my experience as a parent. So my early start in this, in question of, how do you get somebody started? I think you start small, and so I got started back when we lived in Washington State, and my daughter went to Seattle Children's, another hospital I am deeply grateful for. And I got involved in a parent-to-parent group. So you would think, well, that's not safety, but it is. I think everything is safety, really, when you look at it. And so I got an opportunity to meet with families who were a little bit earlier on in the process than I was, and we got to talk about experiences and what they should expect. And part of that is what do you do when you see something that you think is wrong? So I got started that way, really got the bug of advocating for others, And then we moved to Cincinnati when my daughter was at age 3, more than 75% of the way through her lifetime maximum of health insurance. Yeah. So, so we moved to Cincinnati because of its amazing neurosurgery department and its multi-department clinic for spina bifida patients, and also because I'm a Hoosier and I wanted to come back to the Midwest. So once I got here, I got the opportunity to get involved in Cincinnati Children's Family Advisory Council. So that's a good way, either as a family advisory council or a patient advisory council, to get families involved in safety. It brings families together or patients in a large group, so it's a little bit easier to speak up if you're new, and you're able to feel like you're making a difference in the hospital. From there, what often happens, and what happened to me, is that people get interested in the work and want to continue. So you can then encourage your families to get involved into specific committees. So, for example, after my work on the Family Advisory Council, I worked with the ICU on their book to families, and really looking at what needed to be there and what didn't, and how they could present safety in a family friendly way. And then it just went from there. So what I am really pleased about and so very proud about is that during my entire time here at Cincinnati Children's, I've been also able to focus on patient safety and parent involvement. Very early on, I realized that the folks at Cincinnati Children's were interested in what the families had to say, and they were open, even though what a patient or a family says isn't always what you as a hospital employee want to hear. So it was refreshing to be welcomed. So through my time as advocate and now director, I've been able to watch Cincinnati Children's push the envelope on how families are involved in safety work. And I think there are some key pitfalls, because we're not perfect. We're never going to be perfect. And then there are also some tips. So I'm going to try to spend the last part of my time talking about a few of those. So one thing is, how do you recruit? I think you recruit by anytime a staff member has an engagement with a patient or a family, and they seem interested, then you say, hey, would you be interested in working with the hospital on some, improvement projects? I think the word safety sometimes is hard for a patient or a family to really know where they would fit in. The first time I was asked about how I felt about safety of the hospital, I thought they were just asking me if I was worried about my own personal safety. I didn't know exactly what that meant. So I think asking simple questions, what are you most concerned about? What are you most worried about? How could we make this safer for your patient or your father or your daughter or yourself? Questions like that. I think it's important once you get people involved to make them feel appreciated, and that is so easy to do. You welcome them specifically at the beginning of a meeting. Hey guys, we're going to have Cindy here today. She's a patient and blah, blah, blah. You also take responsibility to check in with them during that meeting. The meetings that I felt the most comfortable in, I would have a facilitator say, Pam, as a parent, what do you think about what this person just said? And then also appreciate them. Some of our most successful safety placements with patients and families, the staff really makes that extra effort to say, because of Joe and his involvement, we were able to X, Y, and Z. So lots of little easy ways to make them feel good, because they are giving their time, they're giving their effort, and they're thinking about something to help you and your facility. Okay? Which leads me then to remember that they're not employees. So this is good and bad, but as an employee, you are paid to come to the meeting and you're expected to be there, right? So patients and families who contribute aren't. They're offering you their time, and we luckily have come a long way, and there's still a very long way to go, but we have come a long way in helping families navigate that. So if possible, do things like offer food, offer reimbursement for childcare or transportation. Luckily, we are finally in a place where we can offer parent stipends for the time that they spend working with a hospital group. And that has made a big difference. That helps bridge the gap to equity, which is a huge concern. You want to make sure that the voices in your safety work reflect the patients in your system and the voices at the bedside. And what that means is that not everybody at the table looks like me. So you work hard, you voice it. I think the first thing is to be very specific and pointed about saying we need diversity in our safety work. We need more people who don't look like Pam, right? And then you reach out to people and you say, we need some help. Would you be willing to? Or do you know someone in your community that would be willing to? We help once we get someone to participate. We help by supporting them. We'll have a staff member oftentimes sit on a call with them so that they feel like they're supported. And we also try to work toward the fact that equity is more than just race or gender or ethnicity. It is what part of the system do they use? It is what is their sexual orientation? It is what is their education? What part of town do they live in? All of those things are important. So I could go on and on. Dr. Muthing knows 12 minutes is probably the shortest time I've ever taught. So I have lots of other ideas. Always welcome to reach out to me if you have any specific questions about what we've done. We're not the best, we're not perfect, but we're proud of where we've come from and where we are so far. And with that, I would like to turn you over to somebody that I've had the very great honor of working with for these last 14 years. She truly is a gem, Miss Deanna Hawkins, a Vice President of Patient Services. Deanna, take it away.
Thank you, Pam, and thank you, Steve, for the invite. Thank you to everyone that's attending. I didn't tell you this, Steve, but when you first invited me, or you asked me about this opportunity and attending this and speaking to this, and you told me the topic, the first thing that came to mind was changing the outcome together. So those of you that are not familiar with Cincinnati Children's and some of our foundational premises, this is actually a quote from past CEOs that have it's stuck with us. We all embrace it. We try to live by it day to day, and it is the perfect example of engagement between us, our patients and families, and empowering them to have a voice as well as our workforce to have a voice. So just wanted to make sure that I called that out because I didn't get a chance to share that with Steve. Also, so since Pam shared more on our actual family engagement, I want to speak briefly to staff engagement, and then give some additional examples of how engaging together for safety, and how having a voice plays out in our day-to-day operations. So let me start by saying what my opinion, my belief is that staff will not be engaged if we are not creating an environment that is conducive to them providing the best care, optimal care. My belief is that if staff are not prioritized, our patients and families will never feel like or be a priority when it comes to safety or anything else. Now, don't go back telling Steve Davis, I don't believe in putting patients first. That's not what I'm saying. What I'm saying is we have to prepare and take care of our staff so they can provide and deliver safe care. And then our patients and families will feel and know that they are our priority. So in my mind, it's empowerment on both ends. Our patients and families will likely not want to be engaged if there is no level of confidence in us as clinicians. So what does this look like for staff? Staff getting engaged, empowering them in our safety journey. And then these few examples that I'm going to go over aren't inclusive of everything, but just a few big buckets that came to mind. So of course, recognition and support. And this goes beyond money. This is about listening, validating their needs, taking lessons learned, especially when it comes to safety, hearing from them what we need to fix in our system and improving that system. Also, when it comes to support, offering that peer-to-peer support, and that's actually a formal program that we have here called peer-to-peer support. So if something is stressful, something really taxing, emotional has happened, we try to provide that peer-to-peer support. To make sure that they can show up, for themselves, for their peers, and for patients the next day or the next time they're with us. And then, of course, training. So first thing that came to mind when I thought about safety was some of the clinical deterioration training and simulations, and going beyond, that didactic or those PowerPoints, and offering high fidelity technology on a regular cadence for our staff so we can make sure that our patients are safe, and doing it on a regular basis and learning at all different levels, innovative ways of how to make sure that everyone is safe. And then Steve spoke to psychological safety. So having that safer together training, that psychological safety training for all levels of our employees, clinicians, leadership, frontline. And then wellness. Wellness is so important. And we do have a formal program, a quality excellence domain for us. And it is based on the Surgeon General's framework for workplace, mental health, and well-being. So this is something that continues to evolve for us, but making sure that we have this in place so we can tap into this as leaders, and so that our clinicians and our workforce can tap into as well when they just need a little bit extra to keep going. And then part of that is workplace violence. So we have a committee for workplace violence, which is a program in itself too here at Cincinnati Children's. And that committee has representations from divisions and departments across the organization. It doesn't impact just those that are on the front line, because we have to make sure that we're taking care of each other. So this might be our protective services that's involved, or how can our technology help us stay safe when it comes to workplace balance, and of course, like our supplies and materials. So again, everyone is involved. There's great representation on this committee. And then also a part of that is the therapeutic crisis intervention and crisis support training, TCI training, which is designed to help us prevent and de-escalate in behavior emergencies. And if we think about, our current landscape when it comes to mental health and making sure we're taking care of those most vulnerable patients, we need to make sure that our staff are prepared, they're trained, they have the skills to protect themselves as well as the patient, and make sure that we're both safe. And also, as part of that workplace balance, we kind of pull it all together, and we have a playbook and a toolkit that we as leaders try to make sure that's available to our staff, or we're going through it and we're offering different themes within it. to be able to share with our staff on an ongoing basis. So I would say a couple of themes that are in that is in the playbook and the toolkit is making sure that we all know and we are using a systematic process for event reporting so we can elevate those lessons learned and again fix those system issues that I talked about a little bit earlier. I mentioned the TCI training already, and then there's trauma-informed care, active shooter training. So again, I'm making sure that this playbook is comprehensive. And as we learn from day to day, we may have to make sure that we're updating that so they have this at their fingertips and they're able to refer to this in real time. And then, of course, the emotional, psychological support for employees that I mentioned peer-to-peer support. Then there's the spiritual and grief care, EAP, co-lavender, and also the stress first aid. The stress first aid is really at the unit department level, and it's about recognizing when a coworker has had something that impacted them and caused some type of stress, whether it's emotional, whether unfortunately it was an unfortunate physical injury. And then acting on it. So how do I, as a peer, reach out to someone to say, I noticed this, I need help. I need someone to come and act on this. So if you see something, then we should be saying something. And that's what we try to teach when it comes to stress first aid. And then lastly, knowing that we have someone that we can trust and be able to speak to in a situation like that. So the other thing too, I would say when all of this comes together, we talk about patient, family, staff engagement, but in my mind, it's a partnership. It has to be a partnership because our caregivers, our parents, they know their child better than we do. So again, it is about partnering with them as an expert and us as clinicians where our expertise is. So one of the things that we try to come together on is our root cause analysis and making sure that we have the family liaison representation there for our parents, as well as serious harm. So we have a monthly serious harm meeting with all of our sites of cares that come together. And we have caregiver and parents that participate in that, and they are physically there. So talk about being vulnerable. This is where we are reviewing our hacks. We are talking about where there's opportunities for us to do better, and they are there and they have a voice as well. And then, of course, rounding, just day-to-day rounding with the care team and making sure that the parent and the caregiver is there, scheduling around when they're going to be there to do that rounding so they can speak to the plan of care, so they can speak to what their concerns are. And we all know, those of us that unfortunately maybe you all haven't had to deal with any serious safety events, but usually the common thread is communication. So again, communicating with our parents, with our caregivers, and making sure that we're all on the same page and we're taking their concerns seriously. The other thing where our engagement and our partnership comes together is called commitment to safety and care for everyone. So this is us recognizing early when we need to support families to ensure optimal care. So they could be having a stressful situation. It may manifest differently. So this is us coming together to make sure that they're safe and that we're safe. It's also us taking the time to be aware of our own behaviors or system processes that may be challenging to them or that may be a trigger or may impact them in a negative way. So that's coming together, having a mutual agreement, whether that's written out or not. But that is a commitment on both sides of things. And our goal in this situation, when we do deploy a commitment to safety, is to approach that caregiver, that parent, with empathy and with support. Obviously, we do not want to increase that stress level. And we also want to take into consideration that there are many factors that may play a part in that, such as culture, stress, or trauma that we don't even know about, or maybe a past provider does know about. So a past encounter. So we do want to make sure that we consider all of that. And then I will say this is probably a very personal, not personal, but a recent example for myself. And this, I will say, was probably the best meeting that I've had of the year. So we have family advisory councils, and we have them at different levels. We have them at housewide level. We can also have them at the unit level, site of care level. So we just recently instituted a family advisory council for acute care. First time we've had some of our parents that were there. That have been here recently, some more frequently than others, just to hear from them. And I will tell you, there was no fluff in this situation, right? There was the praise, there was recognition, and there was also opportunities to do better. And our parents did not hold back. And remember, I said this was probably the best meeting of the year. But even with all that said, it absolutely was. It was a very good balance of things that we need to hear. So in my opinion, when we do these type of things, when we come together with our caregivers, with our patients and our families, especially in these type of settings or these situations, the key is making sure that we have clinical and operational leaders that are there doing the work and who can make decisions about things that we might need to change, or take that message back that is empowering, that we're hearing from our parents and our patients, and be able to give that message back to our caregivers and our clinicians, because they want to be empowered as well, to be able to deliver and provide that safe care. So I just wanted to make sure that I shared that, because that was a personal example of partnership that I was able to participate in, even though I don't get to be a real nurse anymore, but still being able to engage with our patients and our families is always the best thing for us, even as executive leaders. So I think that is my time. And I think I'm going to hand this back over to Steve. Thank you, Robert Adams, for saying I'm a real nurse.
And Fran, I'll go ahead and turn it over to you. We just wanted to remind everybody we welcome your ideas. We'd love to learn from you, and please challenge us. We're learning right now. So thank you. So next slide, and really I'll turn it back to you, Fran. Thank you very much.
Great. Thanks so much to all three of you, Steve, Pam, Deanna. That was really fantastic. I've got a page of notes here. There were a lot of pearls in what you said, as evidenced by the chat as well. And I'm sure we're going to get some good questions as we delve into it. So I'll use some of the questions that people posed in the chat early on. If folks have additional questions that they'd like to ask, please enter them into the chat now. You know, a couple of things that between the three of you mentioned that I think are just worth reiterating. One is what you said, Deanna, about taking care of the staff. You know, I've heard that before. I heard that from Quint Studer probably 25 years ago when we were all talking about customer service, when that first became a big thing in hospitals. And he said almost the same thing. He said, take great care of your staff and they'll take great care of the patients. Make sure that they're cared for and have what they need, and they'll take care for the patients. And I think your point about it doesn't just impact safety is just so spot on. It really does impact everything. One of the items, Pam, that you mentioned that I thought was really good, and I'm going to ask if you have any tools or specific examples that people might want to use. The wording is so important when engaging the families and patients and encouraging them to speak up. Just doing that and giving them opportunity to do so really can enhance that whole speak up culture and enhance safety without having to say to patients and families things using the word safety, because we don't want them to feel like we're putting the burden of safety on them, because it's our job. And we also don't want to scare them into thinking that they're in a place where it's not safe to be. So do you have any specific tools that you've used or that we could point other people to scripts or other types of documents that help staff frame it in the right way so we're giving them the opportunity to speak up without scaring them?
Sure. Thanks for asking. I think the first part of it is to remember that when you work in a health system for any amount of time, you adopt their vernacular. You speak in acronyms, you use phrases like root cause analysis, you say, was there a safety concern? Those aren't things that real people say. and it is especially not what patients and families are thinking about and processing while their loved one is ill. So I think we need to talk to people like they're people, not like they're patients or hospital employees. So dumb it down, get rid of all those fancy acronyms that you have. Just this week, I was talking with someone who has had a brain injury, and she was talking about how she's on an advisory council for another organization, and what they did is they had little signs that look like a stop sign that says no acronyms. And so if the people who were on the advisory council heard an acronym and they didn't know what it was, all they had to do was flap that paddle up. Which was safe for them because they didn't have to say anything. And it reminded the staff to not use all of those words. I think it is helpful as you invite patients and families into the work, as you train them, have a real conversation about, you're going to hear a lot of things that don't make any sense, and normalize it. It didn't make sense to me either when I first came here. Like I said, when I was asked by the great Pat Pilcher, a clinical director on one of our units, years and years ago, Pam talked to me about safety. I had absolutely no idea what I was supposed to say. And I'm college educated, taught high schoolers, and by that point had been the mother of a special needs child for many years. And I had no idea what she meant. So allow them the opportunity to be honest about the fact that sometimes this communication is hard, and be vulnerable. Thanks.
Great. Thanks so much, Pam. Super helpful. One of the items, Steve, that you mentioned when you had your slides was, and I really liked it, you had the number of patients spared. And I really liked it because it's flipping on its head what we normally report, and that is the number of patients harmed. And one of the reasons that struck me was I did a presentation a few years ago, and I was talking about doing root cause analysis on things that go well as things that go wrong, which more places are now starting to do. And I'll never forget this. A nurse came up to me afterwards and said, "Thank you so much for talking about the positive. As a nurse, I feel like the patient safety movement has just been beating me up for the past 10 years because it always focused on everything that went wrong." And I almost fell over by her comment. And it really made me rethink all my presentations going forward. I'm curious, Steve, from your perspective in getting that culture of safety more embedded, have you found that emphasizing the positive and the patient spared and that type of approach has helped get staff more involved, and has it helped with the patients and families as well?
Yeah, thanks for pointing that out, Fran. And it has been quite a learning. At times, we do need to talk about the fact that we hurt this person, or these two nurses are missing time from work because of this. But listen, the reality is we're all humans, and it is a natural human desire, perhaps even instinct, to make the world better and leave it better for, whether it, at the most basic level, for ourselves, for our family, for our friends. And, I have to say, Fran, one of the fascinating things is we've learned to work together across organizations, and it could be the same across departments or across hospitals within a system. It is such a joy to know that something I've contributed has led to decreased harm at another organization or across the state or across the whole system or the nation in SBS's place. It's something I like to go home and tell my family about. Is, do you know what? We actually were able to save this many kids. Will I ever meet them? Do we even know who they are? No. But it turns what is at times just a weary work, day after day, month after month, year after year, into some joy. And I think we could all use a little bit of that some days. So thanks for asking about that, Fran.
Yeah, absolutely. So going back to the chat questions, and Deanna or Pam, one of you might want to take this one. How do you support the staff for engaging patients and families when they may be going through a very stressful time and, maybe getting labeled as a difficult family partly because they're stressed? What strategies do you have to do? I see Pam wants to jump all over this one.
I will take that one. I've been one of those parents before, and I try to start whenever I talk about this. I'll say that, right? And I may be one again next week or next month, which first of all just humanizes it. This is the question that if I knew the exact answer to, I would be a millionaire and I would just live at home on my farm with all my dogs for the rest of my life. None of us have solved it yet. And I don't know that we're ever going to. I am super honored to have worked for the last about 3 years on Cincinnati Children's next evolution of looking at this. We used to use behavior contracts, and those don't work because think about when I was in 2nd grade and the teacher sent me to the principal. That didn't make my behavior any better. Dr. Muthing can probably tell you that. But instead, what we have done is we've moved to something called a commitment to safety and care for everyone. Lots of letters. Here comes another acronym. It's a CSCE. But what it is it is first and foremost a recognition that problems don't come out of nowhere, and problem families don't come out of nowhere. We have problems, we have difficulties because, hello, they're going through one of the most stressful things in their lives. And they have other things going on as well. And the same is true for employees. And so maybe the employee isn't their best self today because they were delivering puppies last night. We got 6 puppies. And so we need to think about that. So what it is it is a way to call out loud and clear, problems are going to happen, difficulties are going to happen, and they're not the problem of one person. It's not this father or that patient or that nurse or that provider. It is all of us, and the only way we're going to get better is to make a commitment together to move forward, and that includes, here are the things that are difficult for me as a mom when the provider does this, this, and this. And then the provider side or the nurses, the social worker can say, well, we really have a hard time when Pam, blah, 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 blah. And then we come together and decide we're going to work together to make it better. Is it perfect? No. Do we have a really, really long way to go? Absolutely. But I'm really proud of that step for us to turn away from it as a punitive and a blaming problem to more of a collaboration.
Great. All right. Thanks so much, Pam. So
Can I add to that really fast?
Sure, very quickly, please.
Okay, very quickly. So I just wanted to say totally agree with everything as far as that CSCE. I think too, it is about making tangible efforts to be able to support staff, especially when you're listening to them. And sometimes it's just about rotating staff, as well as we have this thing called Cold Lavender, and I didn't go into detail, but sometimes it's just giving them a moment to take a step back and think past themselves. So it is literally going somewhere in a Zen room, like literally taking time, have the candles, the essential oils, all that good stuff. And I use it sometimes too.
Yeah, sounds like a good idea for myself. Thanks, Deanna. All right, we've got just a couple minutes left, so we want to hear again from all of you. And thank you for everything that's in the chat. We're definitely going to be going through that. We're going to pose one more question to all of you in the chat. I mentioned at the beginning, this alliance is all about action. So based on what you've heard today, what is one action you plan to take in the next month? I'll even ramp that up, maybe next week, to engage and partner with patients and families in your organization's safety efforts. We'd love to see some examples in the chat as we wrap up, and I'll be scanning them in just a moment. And while we do that, we just have a couple of more slides on some upcoming training opportunities and events that may be of interest to all of you as you're working on this. So we'll go through those while folks are typing into the chat, please. So a few things coming up in the next few weeks that we thought might be of interest to you. There is Team Steps training available. There you can see there's a QR code and a link here for the training available on Team Steps, and that is available through November of this year. This is full day training with no charge to participate. And then on the next slide, I think we have more about Team Steps training. This is on improving team communication, also available through November. This is at different lengths, and again, no charge to communicate. And there are links and QR codes both in the slides. One more item that we want to mention to you that's up and coming in the next few weeks, and that is around surgical safety. So this is from AHRQ, again related to Team Steps, on Thursday, July 25th at 1:00 p.m. Eastern Time, enhancing surgical team communication. And you can see the links to register are available there. And then finally, our next webinar will be coming up on July 16th at 12:00 Eastern. And that will be focusing on making healthcare safer by design, which is aim number 3 in the Alliance plans for the year. Also, here is the link to register for that webinar, and a reminder that you can subscribe to a monthly bulletin for the National Action Alliance, and you can email the team at any time. And we will definitely be saving and taking a look at all of the great things that I see coming into the chat here. We're at the top of the hour, so just going to thank you again, Steve, Pam, and Deanna, for your wonderful thoughts today and willingness to share with everybody in the Alliance the great work that you're doing. And we've learned a lot today. Like I said, I've got a whole page of notes here myself. So thank you so much for your time. Thank you to everyone who joined us today or who is listening to the recording. We hope to see you next month on July 16th. With that, thanks all and have a great day.